The virus variant is the latest new concern in many countries. The CEO of the company partnering with Pfizer says their COVID vaccine will likely work against these variants.
Our vaccine continues to be effective against those 19 variants. This is a new one. It's new in the last few days. So we're currently testing in the laboratory to see if this variant or our vaccine works against this variant like it has done with the other 19 variants.
And here to discuss more is Bloomberg's Riley Griffin. Riley, thank you so much for joining us. We know you've been covering this during the pandemic. And to start out, just tell us, how concerned should we be about this virus mutation? Has anything changed since yesterday?
It's a great question. And I first just want to say that amid this global frenzy, it's important to note that viruses constantly change through mutations that arise naturally as they replicate and circulate in their hosts. So this is to be expected. This is not the first mutation, and it likely won't be the last. What the concern here is really about is regarding transmissibility. Preliminary analysis in the UK suggests that it might be as much as 70% more transmissible than other circulating SARS-CoV-2 strains, and contributing to a spike in cases in the country. Now, we've also spoken with Dr. Moncef Slaoui, the chief scientific advisor of Operation Warp Speed, the U.S.-driven effort to develop COVID vaccines and secure supplies. And he says that data is not yet conclusive. We can't yet determine factually in a very conclusive way that this is much more transmissible than other strains. I think that's what we're looking towards. The WHO is investigating this as well. We need more information to ascertain whether or not this will spread more easily. And what we've learned in the last day is basically that governments around the world, the US, Germany, France, and Switzerland, officials in these countries are ultimately saying that it's possible that this strain is in the countries already. You know, the CDC has noted, for example, that scientists haven't sequenced the genetic coding for many COVID-19 infections here. So it's possible, and we must stay vigilant.
Now, I'm glad you mentioned that, because that was actually my next question. Do we know for sure if it's in the United States? But getting back to your point about transmissibility, it's more transmissible. Does it mean that it's also more fatal?
We think it's more transmissible, but we don't have conclusive data on that yet, and we don't know if it's more fatal. So again, we're going to need to turn to the scientists here and the public health officials. They're gathering information in real time, but in the interim, we just must stay vigilant with social distancing measures and all the other protocols that have been guided by governments across the world.
Riley, are existing COVID tests tracking this new strain? Is that how we found out about it?
So a general COVID test would not tell you about a new strain. You actually have to take the genetic coding for these infections, which is why, we don't actually know about all the different mutations. It requires a very deliberate process. Your average COVID test doesn't account for these things. Or tell the lay public what those genetic samples look like. What we do know is that the two earliest known specimens of this specific strain were collected in late September in London and the nearby county of Kent, and the cases continued to be found through early December. One reason the new variant proliferated was that its emergence coincided with the festive season, traditionally associated with family and social mixing. So there's been a surge that's not just related to this variant, but also due to the holidays.
That's true. And so you've covered Pfizer's vaccine pretty extensively. What can you tell us about its ability to address these new strains?
Yeah, it's a great question. Well, messenger RNA is a very special technology that's never before been used in an approved medicine or vaccine. And as you've heard the BioNTech CEO say, the real beauty of this platform is that it's a bit of plug and play. You can directly engineer the vaccine by plugging in some of that genetic information called messenger RNA, and the output takes place in the body. So it's different from other types of vaccine technologies where you might have to identify the variant. Here, you can enter that specifically into this platform. As CEO Albert Bourla says, he calls it like a cassette tape that you're entering into a cassette player. That's how simply he puts it. So the idea here is that the mRNA platform will be able to tackle this, whether or not the COVID-19 vaccine, as it currently stands, does.
Okay, as it currently stands, does. Thank you so much for that context, Riley Griffin.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.